Thank you, Jos. Patients who have undergone laryngectomy secondary to head and neck cancer experience emotional trauma due to communication and/or swallowing difficulties as they reintegrate into their community. A qualitative study conducted by Dukes, Goldstein, McQuestion, and Malashis in 2012 presented the experiences of laryngectomy patients post-surgery. This article supports the clinical guideline recommendation of voice, communication, and swallowing preoperative counselling. This article illustrates the significance of the surgery on patients' former lifestyles pre-laryngectomy and the process of adjustment to their new reality. Patients provide insight into the emotional difficulties that arise secondary to the surgery and reiterate the need for support during this adjustment period. The Laryngectomy Clinical Practice Guidelines complements this notion by recommending preoperative counselling in multiple areas of speech pathology practice to assist patients' preparation and transition. Thus, we have developed a resource for clinicians to use when working with this population around two recommendations from the Laryngectomy CPG. First, patients undergoing total laryngectomy surgery should be counselled preoperatively regarding the potential long-term impact to swallowing function. And second, patients undergoing total laryngectomy surgery should be counselled preoperatively regarding potential methods of voice acquisition post-surgery. These are two crucial recommendations to ensure that clinicians are providing patient-centred care in the area of laryngectomy. Ensuring adequate preoperative counselling is provided to all laryngectomy patients is an imperative component of the speech pathologist's role, and as such, we devised a resource to assist with this transfer of information to allow patients to make educated decisions regarding their laryngectomy management. The development of the Laryngectomy Care Brochure is designed to assist speech pathologists within their preoperative counselling roles. Its purpose is as supplementary material to be used in conjunction with family meetings and verbal counselling sessions. The brochure will assist new graduates better inform patients and their families of the nature of the changes they will experience if they undergo total laryngectomy, as the written resource is something patients can take away from the aforementioned sessions to further educate themselves. Patients in the qualitative study use terms such as overwhelming and shocking to describe their experiences in laryngectomy preoperative counselling sessions. Due to the nature of the information being provided in these sessions, it is easy for patients to become quickly overwhelmed and consequently be unable to take in large amounts of verbal information in the one session. Thus, this brochure aims to assist new graduates adhere to the recommendation of thorough preoperative counselling by providing them with a tool to more thoroughly inform their patients of the wide-reaching consequences and impacts of laryngectomy surgery. The brochure is comprehensive whilst remaining relatable to patients as it refrains from jargonistic terminology. The layout of the brochure is clear, allowing patients to readily navigate to sections of interest. The use of images provides an additional resource to patients to increase their understanding of the underlying anatomy and physiology involved in the surgery. The brochure discusses in detail several areas of relevance to patients, including stoma care, health professional involvement, humidification, and cleaning. This information is essential for all patients to be aware of prior to the surgery, and having access to a document such as this brochure allows for clients to be more familiar with what to expect, and in turn this will translate to more efficient, individualised preoperative counselling sessions, as patients can ask more specific questions and have a greater understanding of what is to be required of them following the surgery. I will now hand over to Rachel to further discuss the brochure in more detail and to discuss its relevance in accordance to the Knowledge to Action framework.